Now, for the past couple of weeks with our friends from Bite Vital, we've been exploring the possibilities of natural medicines and treatments. And today we're joined by Dr. Guy Ashburner, who is a qualified and registered osteopathic physician. We're talking about osteopathy today.
Yes.
And it's called osteopathy.
Yes.
So tell us about it. What exactly is osteopathy all about?
Osteopathy is a hands-on clinical medical medium which basically treats pain and dysfunction in the body. So if a patient comes, it was established in 1874 in America, and across the world there's thousands of osteopaths. Like in the UK there's about 6,000 osteopaths. In this country there's only about 50.
So it's a lot more common. 50 in South Africa and then
50 in South Africa,
okay.
So if a patient's going to come into a treatment, what we're going to do is we're going to talk about your symptoms, first of all. They could be simple, they could be long and complex. We take the time to go through all of the symptoms.
Yeah.
Then what we need to do is we analyse the history, the full medical history. Then we go for examination. So, for instance, if we're looking at the head and neck, we're going to turn you around, okay? We're going to look at the spine. We're going to see how it moves or doesn't move. We're going to move the head to the side and the other side. We're going to get the arms to move up and down, that sort of thing. And we're going to generally look at the movement of the body or the lack of movement in the body. Okay? If you can line aside.
So this would be the first step if a patient were to come to you for treatment. You'd kind of analyse them and, to know, like you say, analyse their movement, because it's based on movement.
It's based on movement. The lack of movement is usually the problem.
Yes.
So let's get you comfortable down there.
Are you comfortable, Liesl?
So then we do the
Good night.
then we do the examination, okay, which would involve.
Now I can face the camera.
We're going to do that in a second. Okay. All right.
I love it.
We'll just blur this out.
Okay.
Does this make my bum look big?
We do a clinical, neurological, orthopedic examination. We've got to come to a clear diagnosis of what's actually happening.
Okay.
Before we can actually treat.
Yes.
And then when we've got that, we can start treating. So we're going to do any number of things basically to get the body to move. Yeah. That's what we need to do.
I guess the question that we always ask when it comes to these kind of treatments is that, is it painful? Is it ever painful?
If something is tight,
yes,
it's going to be invariably sore to a degree. But we have to get through those restrictions to make the body move better.
Yeah. And what kind of conditions would you typically treat with osteopathy?
We treat adults, babies, children, sports people, people in chronic pain, people, even sports people who don't have pain. So you can actually improve your performance by having the body move better, and then you're less likely to have a problem. But we can treat shoulder problems, neck problems, knee problems, arthritic problems, tennis elbow, frozen shoulder.
That's a lot of things.
A wide range of things. But you can also treat problems with the chronic chest infections as well. It's about getting the body to move.
Okay. So how's your body moving, Liesl?
I don't know. We're going to see right now.
Is her body moving?
Tell me if I'm moving.
You need to line your back. Okay.
Need to line my back.
Yes.
Okay.
So this will be better. You can.
I wonder if this it's going to improve like your Shakira hip movement thing when you.
Listen, I don't even have Shakira hip movements, so.
You nearly just took your teeth out with the mic.
I'm a walking accident waiting to happen.
All right, so at this moment, you're moving her neck. What would you be feeling on right now?
We're looking for restrictions in the neck. We're looking for immobility. We want to get the whole body to move better. So essentially, we don't want just, if we've got a neck pain, I'm not just going to focus on the neck. We're going to look at the whole body.
Yes.
Because invariably what happens is you get restrictions in other parts of the body, such as in the thoracic spine, but then you're going to get problems in the neck and in this area. So as an osteopath, I'm not just going to focus on okay, there's your symptoms. I'm going to zone in the symptoms. I'm not going to just do that. I'm going to look at the whole range of things.
So what have you identified right now by what you've done with Liesl so far?
Well, first of all, we haven't taken a whole case history. So what we can understand that there's a lot of restrictions in the neck here, and the upper back doesn't move as well as it should do. We could make these pectoral muscles looser, because if our posture is better, we function better. Essentially, if the whole human body is moving as it should, as Mother Nature intended it to be, then what's going to happen is it's all going to work. The physiology is going to work.
You'll be healthier. Because
any disease process starts with restriction in the body, ultimately. And if we get ourselves to move, then we've got health. Movement is life,
indeed,
essentially.
Dr. Guy, thank you very much. Really appreciate your time. If you want to find out more information on osteopathy and the treatments available, go to our website, expressoshow.com. Are you feeling all right?
Look at me, I'm moving.
I wonder if Hannon can move like that.
Stay with Expresso and SABC3.